I'm Dr. Mohan Thomas. Today I'll be speaking to you about liposuction. What is liposuction? Liposuction is the procedure by which targeted areas are rid of the fat in that area. The most ideal locations are those areas that do not respond to diet or exercise. Liposuction is a body contouring procedure and brings about no loss of weight. It is not a weight loss procedure. There are many types of liposuction. I have mentioned to you who the ideal candidate would be, somebody who's got a small area that he cannot get rid of. Larger areas can be done. They're referred to as mega liposuction. Is something that we don't recommend all that much, and it has to be done in a hospital setting. So the traditional safe procedure of liposuction consists of removing approximately 5 to 7 liters of fat from one targeted area. These designated areas are marked. Then we use a technique called tumescent, where large amounts of fluid containing local anesthesia and some other things to reduce the bleeding is injected through tiny openings in hidden areas into the area. You inflate the area. Once the area is inflated, then you go about taking an instrument called a cannula, which is a hollow rod attached to a suction device. Using that, the fat is removed and the body shaped at the same time. That is referred to as SAL, suction-assisted liposuction. There are other technical advances that can be used to get rid of the fat. For example, SAL is suction-assisted liposuction. PAL is power-assisted liposuction. RFAL is radiofrequency-assisted liposuction, which also shrinks the skin. Then you have laser-assisted liposuction. Then you also have something called VASER, vibration amplification way of removing the fat. All these are superior techniques that cannot be used by a novice. You need to be very good at what you do before you start using faster, quicker devices with a large amount of energy being delivered to the area. So we can get the body perfectly shaped. In a man, we can give him a six-pack very easily, almost instantaneously. In a female, we can give them a curvaceous body with a bikini curve and a thigh gap, which is what all women want. The key thing I want to emphasize is the success or maintenance of the result is dependent upon a good lifestyle and exercise, without which all these procedures will not have a long-term effect. Lastly, but not the least, how much downtime should you expect? Usually, they're done as daycare procedure in large volumes in a hospital for a day or two. Large volumes meaning 7 liters and above. You have to wear a corset after the procedure for about 4 weeks, after which you can take them off. Gym exercise, intimate physical relationships can be started after about 6 weeks. So liposuction today remains as the one procedure that is so safe and so predictable. However, in the hands of poorly trained personnel or doctors, you obviously can have some really bad things happen. After all, this is a skilled service. My parting advice to you is identify the area you want addressed, adopt a lifestyle, a healthy lifestyle and exercise, and see and get treated by a surgeon who is highly trained, skilled, experienced with a large volume of work, particularly in body contouring. Good luck to you.